Friends, it's Dr. Cameron Rokhsar. Today I want to talk about potential issues that can happen with Botox, and if you encounter those issues after your treatment, how you can potentially fix it. This is a topic that's, I think, very important. It's seldom talked about, but I think that it's good information for you guys to be equipped with. It also will kind of illuminate some issues that you may experience, how to solve it, and also potentially how to avoid some of these issues. So as we all know, Botox is the most common cosmetic procedures performed in the United States and around the world. It's been around for cosmetic reasons for 20 years. Prior to that, it was available for medical reasons for many years. And certainly in my practice, is one of the most common things I perform on a daily basis. Now, what are some of the issues that can happen with Botox that people complain about, and what's the reason for it? The number one issue that people complain about is that they feel like their eyebrows are too heavy or their forehead becomes too heavy. This simply has to do with two things. One is if you're using too much Botox. If your injector is injecting too much Botox in your forehead, potentially it can give you a heavy eyebrow, and a heavy eyebrow translates into a heavy forehead. So people feel like they've got too much eyelid, they don't have enough eyelid all of a sudden. Their eyelids also become heavy. So that's from that. So that's this area that we're injecting. So this is the frontalis muscle, and these are the horizontal lines that we develop. So when you inject too much Botox in here, the eyebrows can become heavier, and as a result, the eyelids can become potentially heavier. So that's just heaviness. Now, unfortunately, if this happens, there's not much you can do except wait it out. So, Botox peaks at about 2 weeks, and its maximum efficacy is about 2 to 4 weeks, and then it starts letting go. So that heaviness feeling that you feel will probably go away on its own in about 2-3 weeks. Now, this needs to be differentiated from a true eyelid droop, which we call ptosis. That's not equivalent or synonymous to your eyebrows feeling heavy. Ptosis happens when there's migration of the Botox into the eyelid muscle. So this muscle that opens your eyelid. And so this happens potentially if your injector is injecting too low in this area. And so when it's injecting too low, some of this Botox migrates into this muscle and it gives you ptosis. So usually when people develop ptosis or the eyelid becomes too heavy, it drops, it's because of that migration of Botox into the eyelid muscle, making the muscle heavy. Now, we have a great trick to solve that, believe it or not. So if that happens in the unfortunate case, ask your doctor to prescribe you an eye drop called apraconidine. This eye drop strengthens the eyelid muscle to actually, so like you can raise your eyelid back to normal while the Botox, takes its course and kind of goes away in the matter of the next 2 to 4 weeks. So that's the trick you need to know about. A very common issue that also happens is that a lot of patients ask for the eyebrows to be elevated, which is something we can do. It's a trick we play, but just remember, the Botox is a muscle relaxant, so it's relaxing everything. And when we raise the lateral eyebrows, it's a trick that we play based on manipulating some muscles up here to pull, relaxing this, and relaxing the depressor muscles on the eyebrow. Now, if you get too much raise of the eyebrow, or some people call that the Spock brow, you have too much of an arch in your brow, there is an easy solution to solve that. So see your doctor, and they can just touch the Botox up by putting Botox above that arch, just very small amounts of it. We can bring back your brows down to a position that you like. So another issue that happens is that for older patients, when we treat the crow's feet is these lines that happen here. And so for that, we treat the orbicularis oculi, that ring muscle. And this ring muscle is the squinting muscle. So by putting Botox here, we relax that squinting process, Therefore, these lines get better. So for older patients that have too much loose skin or too much laxity here, if you put too much Botox in that area, potentially that loose skin can relax on your cheek area, and then the cheek area looks unnatural and maybe heavy. So really what's happened is that when that happens, that too much Botox was injected in your crow's feet. Unfortunately, there's not an easy trick to fix that. You just have to wait your time till your Botox kind of goes away, and again 2 to 4 weeks. A common area that we also inject is the upper lip area. This is the pursing of the mouth muscle, called the orbicularis oris. So we actually put a little bit of Botox here. This relaxes those vertical lines in patients that don't like that. It's a very nice technique to do that. It just relaxes it. Again, the trick for this area is not to put too much, just to put a very small amount so you relax the muscle without losing control of your lip. Because if that happens, potentially you may have difficulty sucking on a straw, and you may also have a difficulty saying letters that use a lot of lip, like the letter P. All right, so the trick to that is use very small amounts. Now, another kind of trendy term you may have heard about is the lip flip that's been trending on Instagram. And then what the lip flip is really putting Botox close to the border to actually flip the lip up. Now, this technique, in my opinion, is a little too much hype. If it works in a very subtle way. But my advice to you is, if you're actually trying to get a lip flip, there's a better way of doing it than Botox in most people, and that is by putting a little bit of filler in the vermilion border, and that border of the lip, and that gives the projection that your lip is actually a little higher. The last thing I want to talk about is Botox for the lower half of the face. Some doctors, injectors, put Botox in the lower half of the face, in this area, and it's the depressor anguli oris, and we put it into that muscle so that this muscle relaxes. This is the muscle that pulls the corner of the mouth down so that these corners turn up. Now, this technique does work, but I do think that this technique has some complications because Botox can potentially disperse into the surrounding muscles, and the results could be blunted, and you may not get the real lift that you want. In my opinion, a better way of raising the corners of the lip, if your corners droop, instead of putting Botox down here, is to actually put a filler down here. And you can get a much more reproducible, dramatic lift of the corner of your lip through fillers than Botox. I hope you guys found this presentation helpful. I think that it's important to choose your injector wisely. Go to somebody who's experienced, who can actually handle potential complications that you may have with Botox. Signing off, Dr. Cameron Rokhsar.